Hello everyone, I'm Alex Alvarez from the Australian Graduate School of Management at the University of New South Wales, and I am here representing Group 5. We'll be discussing the COVID-19 strategy of the United Kingdom along with its changes and results. But first, a quick recap. The first cases of what we know now as COVID-19 were recorded in China in early December of last year. But the outbreak was officially reported to the World Health Organization on the 3rd of January of this year, once the gravity of the situation became clear. Over the following 2 weeks, China started implementing quarantines. Moreover, travel bans and border closures began worldwide as the virus reached pandemic levels. And by January 31st, the United Kingdom had reported its first case. But it wasn't until February that we finally knew what to call the virus. Think about that for a moment. It took longer for the scientific community to agree on a name for COVID-19 than what the virus needed to spread worldwide. Therefore, before we pass any judgment on countries like the United Kingdom for their apparent slow or inadequate strategies, let us keep in mind that these are life or death decisions, and that billions of dollars, not to mention the geopolitical balance of power as we know it, are also at stake. So it stands to reason that a European superpower with an overly complicated system of government, like the UK, would be less efficient than a country like New Zealand, for example. Nevertheless, precisely because the United Kingdom is a world superpower, one would have expected them to have enjoyed more success, especially after others had already implemented some or all of the following measures to lower infection rates, save lives, and avoid financial doom. These include increasing hygiene practices, promoting the use of face masks, imposing travel restrictions, testing and contact tracing, banning large gatherings, closing schools, social distancing, and prohibiting all non-essential work. The relative cost of these measures, of course, varies greatly, but the UK was notoriously late in adopting all of them, and cost alone could not have been the reason why, because some of the most widely proven best practices, such as frequent hand washing and promoting the use of face masks, are essentially free for any government to implement. Yet, for reasons that still baffle us all, the UK government chose instead to ostracize the use of face masks, at least until the Prime Minister himself became infected. I think we can all agree that it's not every day that every country in the world is trying to solve the same problem. So with such a plethora of examples of what's worked and what hasn't, we can only hope that the lessons learned can be more universally applied from now on.
Hi everyone, Diego Camarano here from ESNT Berlin. Thanks a lot, Alex, for your introduction. Let's now move forward and look at the specific choices carried on by the British government. Initially, the government tried to leave the virus circulate freely. The hope was to have a gradual spread and a high percentage of asymptomatic patients to avoid bottlenecks in the intensive care units. This would have allowed to reach a herd immunity without imposing severe measures, although this decision was never officially declared. However, this was not the case, and the number of critical patients escalated so fast that the government had to make a U-turn and follow the lockdown approach that Alex described before. Also, in hindsight, the World Health Organization head, Dr. Ghebreyesus, has recently disapproved a herd immunity strategy, as it would mean allowing unnecessary infections, suffering, and death. Let's now look at some specific examples of how the government managed the crisis after the critical phase. If we consider the job market, a valuable example is the Cyber First campaign. This was initially started in 2017 and aimed to attract more young students to scientific disciplines. This campaign was strongly brought back to the public attention in 2020. In fact, the government published a skills survey aimed to help people to discover possible alternative careers in sciences during the hard pandemic times, using the motto Rethink, Reskill, Reboot. However, this survey was published with advertisements that, due to their controversial message, went much more viral than the campaign itself. We can see here the reaction of the famous DJ Fatboy Slim and an older literary reference shared on Twitter. If we analyze the relaxation of the restrictions, it is interesting for students like us to concentrate on a couple of examples, the first being the hospitality sector. Obviously, pubs, bars, restaurants and clubs were obliged to close during the whole lockdown, as they were not considered essential businesses. For this reason, they were also among the last ones to reopen. And this happened with a series of limitations. No alcohol served without food, registration of all customers, specific distancing rules between tables. These measures, however, seemed sufficient to prevent a second outbreak. Therefore, the government launched the Eat Out to Help Out campaign to further help the hospitality sector. This campaign, in fact, revealed to be quite successful. Another example close to our audience is what happened with universities. Like many others, universities were also closed due to the lockdown until the end of the academic year 2019-2020. With the trend of relaxations that came in the summer months, universities were allowed to offer a normal face-to-face teaching for the coming academic year 2021, although this was not recommended by many scientific institutions and individuals. In more recent times, however, a new surge of cases has been recorded. Although this coincided with the start of the new academic year, the first answer put in place by the government was a new set of restrictions for the hospitality sector. Quite obviously, a high number of opposers protested against this choice. However, due to the growing trend of new positive cases, many universities in specific regions had to move again to full online teaching. This happened exactly after the full university fees were paid by students and their families.